Welcome to the Vital Spirit podcast. I'm Dr. Kelly Livingston, a naturopathic physician and your guide to a new health reality, one that connects body, mind, and spirit. Together, we'll dive deep into the art and science of holistic healing. Through working with hundreds of women through midlife transitions, I've discovered something profound. Most of our physical and emotional challenges are rooted in a maladaptive stress response. And true healing begins when we regulate our nervous system. Each episode will explore complex health topics in simple, empowering ways, uncover the deeper wisdom within each of us, and share practical tools for nervous system regulation to help you awaken your vital force and create lasting wellness. So, if you're ready to reconnect with yourself, your health, and your purpose, let's begin this journey together so you can experience life more fully human and deeply healed. If you've ever been told you have SIBO or you've wondered if you might, then today's episode is for you. Because while SIBO has become one of the most common digestive diagnoses out there, I want to help you see it a little bit differently. Hi, I'm Dr. Kelly Livingston, and this is the Vital Spirit podcast. After 13 years of successfully treating hundreds of SIBO and complex gut-brain cases, I've come to believe this. SIBO isn't the problem. It's a symptom of a body that's lost its rhythm, and the key to lasting healing isn't eradicating bacteria, it's restoring balance. When I initially started treating SIBO many years ago, patients would inevitably latch onto the diagnosis as a beacon of hope, essentially. And this made absolute sense because, you see, oftentimes these patients had been told that there was nothing on their labs, that they have IBS and there's nothing to do about it. So hearing that there was something that we could test for and identify and name was a relief. But it's not the whole story. I definitely got really good at killing off or eradicating SIBO. I do use a complex eradication and rehab plan. It is nuanced. It is different for every patient, but it was never ever just about killing the germ for me. But some patients didn't necessarily want or have time or think that they could do the mind-body work. And some people didn't get better if they didn't. I really started to see with my complex SIBO patients how important nervous system regulation and the state of our parasympathetic and sympathetic nervous system really is. So yes, sometimes we are focused on testing, killing, eradicating to a degree. We might utilize breath tests and antimicrobial herbs. We might utilize diet. And absolutely, I would see that patients would feel better for a while, or maybe they had done some of these things with another physician or healer before they came to see me, but then they would relapse. That was the pattern that woke me up that there was something much deeper in some of these patients' cases. And I realized that we can't fix SIBO just by focusing on bacteria alone, because the bacteria is never the root cause, right? They're simply responding to the terrain that they're living in. We have plenty of episodes on this. I'm sure that makes total sense. You can go back and listen to the germ terrain theory episodes, right? So as I was working through complex SIBO patient cases who had done every herbal eradication, every prescription, rifaximin, maybe metronidazole, erythromycin, I really started to hear the same story over and over, whether it was antibiotics or herbs that they had used, that they had done this RID portion, but no one had really talked to them about the gut-brain axis or emotional regulation or their trauma history. And so I was really diving deeper into topics like research on polyvagal theory and nervous system regulation, because again and again, I was seeing patients relapse when they stayed stuck in fight or flight. Remember, your body has to be in a healing state to heal. When we're working on a complex chronic digestive condition like SIBO, we have to get into our healing parasympathetic state. This was absolutely the key for so many of these complex chronic cases that I was seeing in the beginning of my career. Okay, so what is SIBO? Let's talk about what SIBO actually is. Let's start with the basics. SIBO, or SIBO, stands for small intestinal bacterial overgrowth. I realize when I say it, I sometimes say it really fast, and patients are like, "What are you talking about, Dr. Kelly?" So it means bacteria. Usually we have normal, healthy species that belong in our large intestine and our colon, but sometimes we can get some migration up into the small intestine where they don't belong, or they belong in small amounts there. There can be some, but this isn't an excessive amount that can show up on a test. Now, remember, your small intestine's job is digestion and absorption. It's where nutrients like iron, B12, fat soluble vitamins are absorbed into your bloodstream. You break these down, you digest and assimilate them, and then you absorb them into your bloodstream. So, when bacteria move into this territory, they start fermenting food too early, and they're going to produce gas, inflammation, and bloating in a lot of people. And over time, this damages the intestinal lining. It can interfere with nutrient absorption. We've talked all about low ferritin in previous episodes. This can be one of the reasons why that might happen, and triggers immune activation. So now there's also something called EMO or IMO, that's intestinal methanogen overgrowth. And this one is involving archaea, not bacteria. But essentially, no matter what we're talking about, there's bacteria in your small intestine where we don't want it. And whether they're producing methane or hydrogen, essentially some of the symptoms that are going to show up for you are going to be that bloating, maybe changes in bowels, maybe constipation. In some patients, it might show up as diarrhea. So depending on what's overgrowing, you can definitely see different patterns. So some of the patterns that you might want to be aware of would be hydrogen dominant SIBO. So that's when you come up dominant with hydrogen producing gas, this breath test that I keep mentioning. And essentially, I will often see more diarrhea or cramping or bloating and some urgency in these patients. So these are the patients that sometimes maybe have been told that it's IBS. You can also have methane dominant SIBO. And oftentimes this will look more like constipation, slow motility, a feeling of fullness, again, that bloating. You can also have hydrogen sulfide dominant. So this might present like a rotten egg smell. You're often going to hear from your partner or your family members, or maybe coworkers that work close to you, that there's that rotten egg smell if you pass gas. You might also be really fatigued. Sometimes I'll hear these patients have joint pain, body pain, brain fog. So testing can help identify the type, but testing is not the whole story. Again, we're not chasing a germ. We're not just chasing this overgrowth. We're understanding why it had the opportunity to thrive and overgrow in the first place. So you also might not match up perfectly. It's not this one size fits all approach, but it's also not that your symptoms will fit into these little boxes. So you might see different types of symptoms with different types of overgrowth. And that's really part of the process when I'm working with a new patient, is figuring out what else is going on, and is SIBO playing a role at all in their healing journey. So let's dive just a little bit more into what the common symptoms are, in case you're wondering, do I have this? So gas and bloating are probably the most common symptoms of SIBO. And also I can definitely tell you that the symptoms range very widely. So they can be systemic, but most commonly you're going to notice bloating or distension after meals, excessive gas or burping, sometimes that indigestion, full feeling, abdominal pain or cramping, constipation or diarrhea. As I mentioned, it can be alternating. You can be more prone to one or the other. Feeling full quickly, or like food is sitting in your stomach. These are probably some of the most common symptoms that I hear. And then systemically, you might experience fatigue or energy crashes after eating, which could also be blood sugar, right? But this can be a symptom of SIBO. Brain fog or difficulty concentrating. Very often that goes hand in hand with bacterial overgrowth, whether it's small or large intestine, I would say. Nausea, reflux, loss of appetite commonly. Certainly nutrient deficiencies. So if I see low iron, low B12, low fat soluble vitamins on a micronutrient panel, for example, I'm thinking, is there an overgrowth, inflammation, digestive component to this? Unexplained weight gain or loss. So a lot of times in perimenopause and menopause, women come into the office and we're working on optimal healthy weight, and SIBO can be playing a role in that as well. Some immune system or hormonal symptoms might include food sensitivities or histamine reactions. I just did an episode on food sensitivities, food allergies, food triggers. You can go back and listen to that. Skin issues for sure, acne, rosacea, especially rosacea symptoms, I would say, are very often linked to dysbiosis or SIBO, which is dysbiosis is, remember, imbalance of the good and bad bacteria. So SIBO falls into this category. Eczema for sure, right? The skin is a reflection of our gut. Certainly, PMS changes, anxiety, mood swings absolutely are going to be linked to gut inflammation. Remember our episode on anxiety and the gut brain axis. Remember our episode on inflammatory depression. You can go back and do a deeper dive into those as well. So, the key is that your severity of symptoms won't always match up with test results. Sometimes we might see really elevated hydrogen overgrowth or methane overgrowth on a SIBO breath test, but they won't always match up. And so I do like to test. I don't think that I ever really am just chasing a test. I really am talking about terrain all of the time with patients. But if you are just listening to this podcast and you're not a patient, you might consider getting some testing done to confirm if any of this resonates with you. So here's kind of a classic patient. Let's say a woman comes into my office, we'll call her Fern, and Fern is exhausted, but she's wired. She cannot sleep at night, and she's probably recovering from some burnout after I hear her intake and her story, and I hear about her personal life and her work stress, and she's eating clean. So she does have a very whole foods-based diet, but everything makes her bloated. She's bloated after everything she eats. And she has been told before that she has IBS, irritable bowel syndrome, and maybe some thyroid issues that flared during one of her pregnancies. And she thinks she has some food sensitivity. She's been tested before and she tries to avoid those foods, but she's still noticing that she's bloated. And she's definitely afraid to eat certain foods. So certain foods like garlic and onion really upset her stomach, and she is stressed out about trying to avoid those. And there's great health benefits of those too. So she wishes that she could eat those. And her digestion feels really unpredictable. Fern is sometimes fine, and then one meal will throw everything off and she can't fit into her pants. And it's really impacting her mental health as well. She's frustrated at this point. And so as we dig a little bit deeper with Fern, the story is always bigger than just SIBO, right? And that's really what I want you to take home from this episode. So maybe she had food poisoning years ago. Fern remembers eating some bad sushi when she was traveling, and she had this bout of food poisoning. And she recovered from it, but it was pretty severe at the time. Maybe she also recalls having an abdominal surgery that could have left some adhesions. I would also say if you've had a C-section, that can be one of the contributing factors. We'll talk about that in just a minute as well. She also recalls having chronic stress. So essentially, thyroid, stress, digestion, potential history of food poisoning, all of these kind of are the perfect storm that can lead to something like SIBO developing. So now her thyroid is contributing to sluggish bowel movements, because remember, if you're hypo or underfunctioning thyroid, you're going to have less bowel movements, more constipation potentially. You can go listen to the thyroid episode for more on that. And so now her bowels are slowing down, and maybe she even has some sluggish bile production. Maybe her liver and gallbladder are compromised. And from some chronic stress, her vagus nerve has been in freeze for years. So this is a very common patient experience. And SIBO is essentially the symptom of all of this, and the terrain, her life experiences, history, everything that I just mentioned is the story that we have to understand, and that we then have to look to root causes to resolve so that she doesn't have the SIBO symptom anymore. So what are some of those root causes? You might hear me mention things like impaired intestinal motility. So we have what are called migrating motor complexes in our gut that kind of sweep through our intestines. And after events like food poisoning, sometimes the nerves are damaged and you're not getting these migrating motor complexes to sweep through and move stool through as effectively. This can also happen from chronic stress. You are hearing me all the time talk about chronic stress shutting down the parasympathetic nervous system that drives digestion. Low stomach acid and bile flow is a really big common root cause of SIBO. So your stomach acid essentially makes it so that you can't have this breeding ground for bacterial overgrowth. And your stomach acid helps you break down and digest food, right? So Say you maybe notice undigested food in your stool or you have had bloating for a long time, there's a chance that low stomach acid is contributing to this. And a proper stomach acid also helps prevent bacteria from migrating upward. So that can be part of the root cause of this SIBO picture. I would also say long-term PPI, proton pump inhibitor use. You've heard me talk about this before on the podcast, or even just low thyroid function, as I mentioned. And so I want to make sure that it's clear that very often SIBO is not the issue. We might find SIBO on the test. We might be treating the SIBO in a way, but there's so much more to it. It can be a gallbladder bile flow issue if you're not making your bile and breaking down fat and protein in the gut. It can be so many different things contributing to this SIBO picture. So anytime you have stagnation, no matter what the cause is, you are going to have a breeding ground for this overgrowth. So whether it's subclinical hypothyroidism, not breaking down your food because your stomach acid is low or your bile production is low, or chronic stress, all of that's going to contribute to this breeding ground for bacterial overgrowth. You can look into ileocecal valve dysfunction. There's this little doorway between your small and large intestine that can get stuck open, and you might experience chronic bloating. It can be because of adhesions in the abdomen or infection. And again, bacteria is going to move upward. I do think that commonly post-surgical adhesions can be missed. Sometimes we'll be doing eradication plans, and maybe we have not in my practice, I'm pretty good about asking all these questions, but maybe you've done an eradication plan with another practitioner and they haven't asked about potential scar tissue or adhesions or pockets where bacteria can grow, or that might contribute to slowing your bowel movements. I'm also definitely talking about many women feel like they just can't relax and have a bowel movement. So we talk about the position you're in when you're going to the bathroom, your pelvic floor health. Definitely hormonal shifts are going to be another underlying cause. So perimenopause and menopause are going to, as you know, you're going to reduce progesterone in that time period. You're going to potentially have erratic estrogen levels and then declining estrogen. And so this will absolutely impact your gut motility. And again, as an umbrella, chronic stress is going to impact all of this. If you're eating in a stressed out state, you're not digesting your food, it's going to sit there and ferment. Blood flow is diverted away from your gut when you're chronically stressed, your cortisol is elevated, your digestive enzyme production drops. Again, that hydrochloric acid production drops, and it's the breeding ground for SIBO. So all of this needs to be considered when we're treating it and when we're wanting to prevent a relapse. Now, one of the reasons that this is really important is that SIBO does impact nutrient absorption. So it doesn't just cause the local symptom of bloating, for example, or weight gain, but your small intestine is where you absorb your nutrients. So if bacteria are competing for those nutrients, then you're being undernourished. And that is where I'll see things like low B12, iron deficiency, again, fat malabsorption, and therefore the fat soluble vitamins like your vitamin A and D can also be low. And undigested food is going to irritate your stomach lining, creating more intestinal permeability or leaky gut, which activates your immune system. So that's going to contribute to chronic inflammation. Chronic inflammation can trigger things like histamine intolerance. And this is going to be really important when we're perimenopausal and menopausal and our estrogen is shifting. And now you might notice you can't break down histamine foods. You're more bloated after eating fermented foods or drinking alcohol or having, avocado or high histamine foods. And it becomes a vicious cycle. So maybe you have SIBO, bacterial overgrowth, poor digestion, nutrient depletion, more inflammation, and histamine overload. Remember that link between histamine and anxiety. So now you're also feeling really anxious. You're more bloated. You're more hormonal. Maybe you have excess estrogen because now you're not moving your bowels. So you're reabsorbing those toxic estrogens. You're tired. You're moody. And you have more food sensitivities. So this describes a lot of women when they first come in to work with me. And that's why I wanted to talk about this today. So I know you're probably saying, okay, what do I do about it, right? So this is not one size fits all. I design these very individualized protocols for patients, but I do want to introduce you to something that I do use in my clinic, and that's the 5R framework as a roadmap. The art of treatment comes from sequencing, from getting a patient into the healing state, from timing, nervous system awareness, but there is a framework that I can essentially introduce you to. Now, before I even do a RID SIBO protocol, I am working on drainage and detox. You can go listen to those episodes. I am working on constipation. I'm making sure we're moving our bowels before we do any sort of RID protocol. So essentially, you need to be detoxing, pooping, sweating, moving your body, hydrated, all of this, all the seeds of health before you start any RID plan. Okay, so what's step one? Step one is just like pillar one of our gut brain axis in the vital spirit method. Surprise, surprise. So, step one is remove, recognize, and remove. This is where we clear the overgrowth. We remove food triggers. Certainly on the antimicrobial side, I'm rotating botanicals, maybe using things like berberine or oregano oil, garlic, neem, black walnut, artemisia. I'm definitely rotating herbs. I'm definitely addressing other things I know about that patient, maybe viral load. Again, this is not one size fits all, but those are some of the herbs that you might see in an herbal antimicrobial rotation. There's tons of research on this now, which is fun. There wasn't always as much research when I first started practicing, but essentially you will weave in things like biofilm disruptors. And I like to look at a full stool analysis, so a whole large intestinal stool test, to have a really great understanding of the entire digestive tract before I'm even doing this remove phase. And I definitely use homeopathy and gemotherapy and drainage. So it's really not just take this herb to kill SIBO, take this herb to kill bacteria, right? It's not that simple, unfortunately. Now, often these phased herbal rotations are not as aggressive as one long plan. I really do like the rotation for many reasons. And I might be weaving in different phytonutrients through that process and adjusting based on what I saw in the breath test if we ran one. Ideally, we have, and in the stool test. But it's critical that if you don't do the RID phase, I do find that symptoms will return. It's certainly not that everyone necessarily needs that. I don't want that to be the take home here, but that there is focus on healing the gut essentially. And so sometimes I'll include things like elemental diets. I'll definitely talk about dietary restriction at some point, therapeutic diets, right? But the real goal is that you're giving the gut a chance to heal and then you're reintroducing things. Now, after removal, in reality, I'm weaving these in at the same time. We are replacing. So we're supporting digestion itself because remember, if you're not breaking down food, bacteria will happily do it for you. They're going to eat sugar. They're going to break down your food that you eat. They love that. So I might be using things like digestive bitters before meals. I might use betaine HCl if stomach acid was low. I might use apple cider vinegar before meals, which is also really good for balancing blood sugar, which is awesome. I'm educating around bitter herbs. I'm talking about bile support if I think there's a need for it in that patient. Maybe I'm considering pancreatic enzymes if I saw an issue with fecal elastase. So there are a lot of details going into this replace phase as well. And very often this is the bridge between the symptom and the healing phase. So it's very much about learning how to care for your gut and your lymphatics daily, slowing down to eat, knowing what foods are your friend or your foe, walking every day. I'm educating around all of these kind of lifestyle strategies around gut health during this as well. And then the next R is reinoculate. And this is with nuance because not all probiotics are created equal. So essentially, we're reinoculating with all of the good bacteria. Maybe we do have a stool test that tells us what bacteria we need to support. Not all are going to be symptom safe with active SIBO, so some might bloat you. I do tend to use Saccharomyces boulardii because it's one of my favorites to use if I do know that patient has SIBO. I will usually individualize this, very much so. I might use prebiotics, maybe guar gum if I know that patient has SIBO. I'm going to then eventually move on to repopulating with more prebiotics once the symptoms are under control. So again, not one size fits all, but I did want you to have an idea of what the reinoculate phase consists of. Eventually, I am reintroducing fermented foods and all of the good fibers that feed your short chain fatty acids that become your probiotics. And then we're moving on to repair. So, after a RID phase where I am supporting digestion, we are repairing. And sometimes I'm weaving repair into that RID phase. Again, it really depends on the patient. Some of the mucilaginous herbs that we might use for repair have polysaccharides that can flare SIBO symptoms. So I am careful around that. So my go-tos initially for repair might be glutamine, zinc carnosine for mucosal lining repair. And then I might be weaving in things like slippery elm, DGL, aloe. We're talking all about food as medicine for repair. So that might look like collagen, bone broth, omega-3 fatty acids. We're always talking about herbs, especially anti-inflammatory herbs. You know, I love a good bag of turmeric root on the counter and you put it in everything. Be careful, it will stain. We might use boswellia. We're absolutely repairing the gut lining and highlighting intake of things like quercetins or antioxidants. And certainly these are all things that I talk about in my Calm Gut Clear Mind 21-day reset. So if this sounds interesting to you, you can dive even deeper into that by looking into that gut reset. There's a button on my website and we can put the link in the show notes too. And then the last are rebalancing. So we're always addressing motility in the nervous system throughout, but we're really having conversations around maybe using prokinetics, maybe supporting motility. Ginger is one of my favorites to use in that phase, maybe 5-HTP to support motility if that patient's still struggling with moving their bowels. But we're really also focusing on rebalancing safety in the body. We're using breath work. We're focusing on sleep and circadian rhythm, stress reduction practices. You know, I love yoga nidra for this. And really highlighting that the gut cannot move if the nervous system is frozen and that your gut will be dysregulated if you're in sympathetic fight or flight. So with complex chronic SIBO cases, for me, it was that education of, oh my gosh, there's a missing piece to this puzzle. When we add this piece to the puzzle, these complex cases are getting better. And why don't I reverse engineer that and start everyone with that? Because essentially you're giving your body what it needs to heal, to actually accomplish the RID phase. And yes, of course, there are dietary changes. Nutritionally, I follow an approach inspired by Dr. Nirala Jacoby's SIBO biphasic diet. She has a podcast on the topic. She has wonderful resources if you want to go check those out. I might start with a lower FODMAP anti-inflammatory plan during the antimicrobial phase, and we're essentially calming and clearing the gut. And then as symptoms settle and as we're working through the RID phase, we're adding foods back in layer by layer. So we're building tolerance, diversity, joy in eating again. I talked about this in the food sensitivity episode. This gentle reintroduction is really what allows long-term healing instead of chronic restriction. We need to feed our microbiome. We need to add foods back in. I typically do this one at a time. And one of the reasons I created the Calm Gut Clear Mind 21-day reset program was because there's often a bridge phase. So there's a phase of dietary changes and focus on the seeds of health that you're going to do before you jump into any sort of RID protocol. So it is designed to walk people through that foundational phase and remove and restore safety before we enter into deeper testing or herbal protocols. So here's what I've learned after 13 years of treating SIBO. You can have the best diet, the best supplements, the perfect labs, but if your nervous system isn't regulated, your digestion won't heal. So when you've lived in fight or flight for a long time, when you've had chronic stress or traumatic stress, your gut is impaired. Your gut health is impaired. And if you're not getting into that rest, digest, healing state, it makes SIBO really hard to treat. So cortisol is so important in this. Our emotional regulation is so important in this. Working on some of those shadow pieces that I've talked about in previous episodes is so important in this. Doing everything that you can essentially to work on healthy movement through sympathetic activation, fight or flight, which we're going to have. It's part of our day. It's a healthy part of our day. And parasympathetic rest and digest. If you take anything from this episode, it is that your microbiome will adapt to the environment. And when we're giving it what it needs, it is the foundation for healing. Nervous system regulation truly is root cause work for SIBO. You can actually see changes in your microbiome when you work on the nervous system. And that's why I integrate the safe and sound protocol, heart math, breath work, vagal toning exercises with my vital spirit method when we're working on the gut brain axis and potentially eradicating SIBO. Because when the body feels safe, the gut can finally rest, digest, and repair. I'll leave you with one of my favorite cases. She was a woman who came to me after chronic methane dominant SIBO. She'd done it all: antibiotics, herbs, elemental diets. She was so afraid to eat when we started working together. She had tons of histamine intolerance. She was starting to exhibit some mast cell activation syndrome. And instead of just jumping into killing, I started with calming. We supported her vagus nerve. We added gentle digestive bitters, which also help with parasympathetic vagal tone. We talked about mindful eating rituals, somatic regulation. We worked on liver and gallbladder support just with gentle drainage. We did castor oil packs and yoga nidra at night. And 3 months later, her bloating was 80% gone. Her bowel movements were normal. And when we did retest, her SIBO had cleared. But more importantly, her life had expanded and she noticed a ripple effect out into her family. Her kids' behavior was better. So she was cooking meals at home again. She said she was enjoying that time with her kids instead of worrying about what to eat. And that's what real, true gut healing looks like. So if you've been stuck in a cycle of restrictive eating, relapsing after eradication plans, or if you have never heard of SIBO before and you want to know more, I want you to know your body is speaking to you. Your gut is asking for rhythm, for nourishment, for safety. And healing SIBO, as with anything in our healing journey, is not about perfection. It's about partnering with your body, listening to your body, and making changes to respond to what your body's telling you. So if you're ready to take that first step toward gut brain balance, I invite you to join me in my 21-day program, Calm Gut, Clear Mind, the 21-day gut reset. This is the foundational reset I use with many of my own patients. It walks you through how to remove triggers, repair your gut lining, and regulate your nervous system so you can finally feel calm, clear, and connected again. You can find all the details at drkellylivingston.com, drkellylivingston.com, just my name and doctor before it. It's also at the link in my social media profile bio, so on Instagram. And if this resonated for you today, please share it with someone who you think is maybe struggling with digestion or you think has had SIBO before and maybe struggled eradicating it. And if you found it helpful, please review it if you can and download and subscribe because as always, this is supported through Roots Deep Medicine, my clinic, and the Vital Spirit Method. And I want nothing more than for more women to hear that there are root cause solutions to their health concerns. And remember, healing isn't about fixing what's broken. You are not broken. It's about remembering that your body already knows how to heal. It just needs the right support. Have a great day.